So, today we are going to learn about Robert's philosophy, chapter number 35 on modern medication and the homeopathic principles. Let's begin. This usually comes for 20 marks or for 5 marks, so write accordingly. Let's understand what Robert says in this chapter. In homeopathy, fundamental principles are based on natural laws. To principles, there is no time element. In dominant school of medicine, in spite of increased knowledge of the mechanism of the body, no guiding principles have been discovered. Drugs discussed under this chapter are aspirin, luminol or coal tar, phenols, sulfanilamides, vitamins, and insulin. In most cases, the discovery of such therapeutic agent has been met with loud acclaim and ardent advertising. Its use became widespread very shortly. The uninstructed and those who are addicted to self-dosing further damage to health. Point Dr. Robert has discovered in his philosophy is aspirin. Aspirin widely used in control of pain by physician and laymen until its depressant properties came to known. American Medical Association published warning against use of it, but except careful prescriber, this was in domestic use. The ability of the trained homeopath to observe and correlate symptoms made it a foregone conclusion that he would easily trace the depressed vitality, the heart's attacks, and many collapse condition to the frequent use of aspirin and like painkillers. Second point is luminol or coal tar. The homeopathic physicians early recognized the dangers of synthetic drugs. Among them is the coal tar derivatives. Third point is phenols and phenobarbital. Phenobarbital are palliative in many ills. Their deadly nature was discovered and warnings were posted against their use, but still it is used extensively. Fourth point is sulfanilamides, useful in infections. Example pneumonia, streptococcus infection, staphylococcus infection, causing tremendous side effects and researchers making less harmful combinations. But along with the proven power of destroying invading organisms, they have a like danger to normal cell balance. Therefore, the system has to overcome the effects of the infections and the toxic effects of this treatment. Sutherland's conclusion was we do not presume, first, to snatch the patient from an acute illness from which, by the grace of his dynamic energies, he might well recover. That is, acute illnesses being always self limiting. Second, to foist upon him a constitutional condition plus the imposed drug illness from which he may never recover. Fifth point Dr. Robert explains in his philosophy is about vitamins. Normal vitamin requirement is from 3 to 25 milligram per day. The excess supply of vitamins robs the body of its normal reception of the natural vitamins. Overdosing of vitamins leads to first the permanent disability of the system to react the normal vitamin intake, second a destructive action proportionate to its normal constructive action. Example, vitamin C and vitamin D help to overcome rickets, and that a certain amount of these are necessary for proper growth and development of the bony structure. It has seen that excessive doses will cause rickets. Next point Dr. Robert explains in his philosophy is about insulin. Insulin administration in the diabetic patient cause loss ability to produce the necessary secretion of its own. Lastly, the conclusion was findings of the clinic do not necessarily because the same relationship to the human patient as to the laboratory animal. Homeopathy laws are natural laws, thus worthy consideration. Do not accept anything new without testing its validity by a sound procedure when available. So, you got the knowledge about this chapter. Thank you for watching. Do please subscribe and share this channel to your budding homeopaths.